Epidemiologist and Head of Laboratory Services in charge of Epidemic Control, Public Health Laboratory at West Africa Health Organization. He has over 15 years' experience, both at national and international levels, in management of public health programs and emergency situations, emerging and re-emerging disease control, surveillance and control. He is also World Health Organization and Global Outbreak Alert Response Network expert and has been deployed as WHO team leader of multidisciplinary investigation experts for emerging and re-emerging disease outbreak response and control in many African countries since 2010. Dr. Abdourahmane SOW is also a strong collaborator with GET, a member of GET, one of the experts that we gladly boast of and is consistent in all our programs. Senegalese, I presume. This is where we borrowed this outfit. Fantastic outfit, sir. Thank you very much for being around, and you are most welcome. Can you give him a round of applause, please? Dr. SOW.
Thank you so much, Mr. Chair. Let me take this opportunity again to thank the organizer and also thank them for the opportunity they are giving to me, and also the honor for offering to me to share some ideas with you this afternoon. Thank you. Can I have the slide, please? Yes. Thank you. Yes, I have been asked to present on effective biosecurity policy in handling and managing infectious diseases. So let me propose you my plan to have just a brief background on WAHO and what we are doing, because this is also an opportunity to, an opportunity to discuss on what we are doing also in the region, and also focus on our regional biosecurity policy, and also share with you some ideas for effective implementation of this policy, and now conclude. Let me say WAHO is a West African organization, health organization specialized on health for ECOWAS countries. And its headquarters is established in Burkina Faso, in Bobo-Dioulasso, somewhere in Bobo-Dioulasso. It is in this context we have able to create the West African Reference Laboratory Network to improve laboratory capacity and also the capacity of diagnostic to detect any public health event in the region. This is the latest bulletin released by WHO, which says last week we had 132 events in Africa, and 115 epidemic are now ongoing in all Africa, including 15 humanitarian crises. This can show you how our continent is weak and exposed to all these crises. Now, currently, we are having Ebola, cholera outbreak, dengue outbreak, Lassa outbreak, smallpox, and many others outbreaks now ongoing in our region. But you can see here, many of those outbreaks are occurring in West Africa now, right now. So we can see now those epidemic can increase our environmental and also the degradation of climate change will increase the population, and also the weakness of our states can expose our biosecurity threats and have a huge impact on health, livelihood, and also economic and political stability in our region. It is in this context we did this assessment in our region, depending on the GE score. For West Africa, we were able to work with WHO to assess all our 15 countries, and the results show us our countries have limited or non-demonstrable biosecurity capacity in all our region. We have just very small countries for having limited countries in biosecurity and biosecurity in all the 15 countries. So what is our challenges? I think the main challenge we are facing is lack of government funding, because many of our governments, they are not care about funding biosecurity, and we are completely or high dependent on external funding for these biosecurity things. The second one might be also the limitation of institutional biosecurity program in many of our countries, and also a lack of coordinated biosecurity and biosecurity training program. We can also see the third one, which is the week of legislation, because yesterday I think we discussed here, in many of our countries we don't have any politics, any legislation, and also we don't regularly conduct risk assessment for biosecurity and biosafety. These are our main challenges we are facing now, and this can show us there is an urgent need to build the biosecurity and biosafety system in the region. And we can say also a comprehensive evidence-based and well-funded policy, legislation, and regulation are needed to combat these challenges. And so we think that government should develop and enforce biosecurity and biosafety laws, and also the framework to prevent both natural and intentional biological threats. It is in this context that, in collaboration with Professor Abayomi and Gates and his team, we were able to develop the regional biosafety and biosecurity policy. Let me thank Professor Abayomi and his team for this occasion. They are offering me for all the support they are giving to us. The objective of this work is to build capacity, accountability, and also the responsiveness for appropriate protection, control, or also for recurring and emerging pathogens in our region. This is an ongoing work. We are still working on it, but I just selected some strategic pillar to present to you here this afternoon. We can see in this program, we focus on more than 14 strategic pillars. For each of them, we have already defined the objectives, the strategies, and also the present challenges. For example, if you talk about the laboratory biosafety and biosecurity, the objective and the idea is to enhance effective direction and coordination, and also to management, regulation, and reinforce laboratory biosafety and biosecurity activities in the region. Coming to public health, the idea is to provide early warning system through integrated disease surveillance. If we take biorisk management and assessment, we can also, the idea is to provide support to diagnostic and public health facilities to be sure they can detect all the biological threats we are facing in our region. There is also something on rapid response and medical emergency preparedness. We have also include animal health and also environmental biosecurity, medical biosecurity, and also the security agencies, because we think we need to provide appropriate structure and system to assess risk and take all the measures to eliminate all the potential biohazard in our region. These are just some elements in that regional integrated biosafety and biosafety policy we already received from GET and teams, and now we are working to validate it very soon. First of all, by all the experts for the region, and also by IHM. IHM means ECOWAS Assembly of Health Ministers, who will validate it technically, and now the ECOWAS Council of Ministers will adopt and also answer the availability of funds to implement it. And now, if necessary, the head of states will ratify it, and now we will be ready to implement in each country. So we will also use this policy to develop our national and regional biosecurity strategic plan to be sure we can protect our region against all these biosecurity threats. We think if we want to make this plan effective, we need strong governance. We need also very good legislation, community engagement, and also funding. When it comes to governance, we think that we need to enhance effective coordination, direction, and also give leadership and also political willingness to bring all the government agencies and partners to work together to be sure they can achieve and implement this plan. And also, this will lead to regularly review and update our laws according to international regulation and treaties to be sure in all our countries we are now able to implement this biosecurity policy and regulation. And also we need to build the trust and also to convince all the stakeholders to be sure we can answer the sustainability of this kind of politics in our region. But we need also domestic funding from just government. If you want to be effective, we need the commitment for all the head of state and government. And let me emphasize on what I heard here for the first day on this conference, when the governor of Lagos State said he will work together with Professor Abdourahmane and team to establish in Lagos a research center on disease research center in Lagos, and also to build big hospitals here to be sure they can handle and manage all the clinical problems and biosecurity problems you are having here. This kind of commitment is what we need, because as Dr. Olamide said, we do have the money, we do have fund, but we need to orientate them for the right section to be sure we can use our money to fund our own needs. In conclusion, what I said now is this kind of policy can be effective because we have emphasized on the mechanism and also the strategies which we need. But to be successful, we need high commitment from all the partners and also the stakeholders within the region. It's why we think all the involved partners, starting by WAHO, has to give leadership, coordination, and also technical assistance and guidelines to member states to be sure they will have good advocacy and also the political will to implement and also to review all the legislation in the countries and also make available funding. We need also to involve private sectors, as my colleague just mentioned, because they can help a lot on funding and also make infrastructure and also equipment for all our labs to protect ourselves. I was very happy when I saw in Lagos you are mostly now depending on the private sector at 70%, I think, something like that. I think this is an example we can also bring for other countries where we are starting with funding from government. And also for all the technical and financial partners, they have to also give technical assistance, guidelines, and also they can participate and collaborate in funding. Because we need them, because they have sometimes many technical assistance and technical guidelines to offer, and also they can provide many support, but it will be under a collaboration. We need to change our paradigm, not depending on only the partners, and now start thinking how to collaborate with them to build our system. It's why here I can say we need this South-South collaboration and work together with all the partners, including GATE, WHO, Africa CDC. All those partners, they are working together to build the capacity and also to improve the biosecurity situation of our region. Last week, we were able to establish the West African Biorisk Management Network, for which it will be a powerful platform to coordinate and to collaborate on biosafety challenges, and also to coordinate and harmonize effort toward harmonizing all the various partners in the region. Because as you know, we are many partners, and we know leadership and also coordination board to be sure we are all working together in the same direction. I will finish my talk by saying, as Dr. Babadoy, let's work together to bring African solution for African challenges. Thank you so much.
Thank you very much, Dr. SOW. I love how you ended your presentation. Let's work together to bring African solutions to African challenges. Can we please give him another round of applause for his very straight presentation and also very detailed? You know, it is often said that you do not